I had too many doctors tell me, oh, it's anxiety. And I'm like, oh, trust me, I've got that too. This is not my typical anxiety.
Yes.
Anxiety should not make you bleed out of places that shouldn't be bleed. I kind of went through a struggle for about 10 years, actually, after my symptoms got really bad, getting a diagnosis.
Where were you in your diagnosis journey when you were in medical school?
I had been gaslit for so long by other doctors that I had seen even before I got to medical school that said, no, you can't have this because of X, Y, and Z.
What was that path to pathology versus internal medicine?
So much of finding your specialty, as I'm sure you can attest, is just where do you feel home? And that was home for me. I've been on multiple biologics now for years and have thankfully found one that has put me close to remission.
Welcome back. My name is Dr. Moss from the Life as a Patient Doctor podcast. I am very excited to interview Dr. Angelina Bortoletto, who's obtained her MD and her PhD from Baylor College of Medicine in Houston, Texas. She's a new first-year pathology resident at Mass General Brigham in Boston, Massachusetts. After over a decade of struggling with gastrointestinal issues, Dr. Bortoletto was diagnosed with Crohn's disease. Hoping to specialize in the GI pathology, she plans to dedicate her career to studying inflammatory bowel diseases and advocating for other patients with IBD. Thank you so much for joining.
Oh, thank you so much for having me. I'm so excited to have an awesome conversation.
Oh, me too. Well, how about you start off? I read a little bit about your background, but how about you tell me who really is Angelina?
Yeah, feel free to call me Gina. I should have said
Gina.
that. Yeah, we're friends now. But yeah, as you said, I'm a brand new PGY1 at Mass Gen Brigham in the pathology department. And I think my story with my diagnosis with Crohn's and wanting to really go into pathology really play in together. I've wanted to be a doctor honestly for as long as I can remember, but I think I started very early on having issues with my gut. It's been a lifelong struggle for me. And just being in that space where you had to deal with doctors all the time, I think I very much resonated with wanting to find out the root cause of issues and wanting to I was always a problem solver. And that kind of fed into me wanting to do science as well. And yeah, I got into my MD PhD. And really when I got into school is when my symptoms exacerbated really badly with stress and any chronic condition that's very common. And so I went through a struggle for about 10 years, actually, after my symptoms got really bad, getting a diagnosis. And that really played into kind of my understanding of a patient too, because as doctors, we learn very much kind of an algorithm about how to diagnose things. But unfortunately, not every patient, not every person falls into an algorithm. And so sometimes you have to think out of the box. And I was one of those cases. I didn't have a lot of the characteristic markers and things like that. And so it took a lot of struggles with doctors before I found one that really listened and was like, yeah, clearly something's going on. And we got lucky and happened to catch it during kind of a flare with my colorectal surgeon, getting in there, getting a colonoscopy when things were happening. And then I really had a wonderful pathologist that caught some very subtle signs on my biopsies. And it was really an interdisciplinary team that took getting a diagnosis. And I'm so fortunate because I've been on multiple biologics now for years and have thankfully found one that has put me about as close to remission as I've been so far. So I know we're really happy and then excited about that. But yeah, that's really what got me into wanting to do pathology, because it was a really subtle finding in combination with like clinical correlation, the scientist stream. And that really got me interested in being a pathology, because pathologists are so important for really making final diagnosis for patients.
Wow, what a journey. And I appreciate
Yeah.
and I connect with you so much. Like being someone myself that also went through a long diagnosis journey of going to different doctors, of
Yeah.
some believing you, some not believing you, some saying it's just stress. It is hard being a person,
Yes.
being a patient, and then even more when you do have a little bit of science background, or if you're
Mm-hmm.
medicine yourself, sometimes in my experience, made it harder. But I'm interested, where were you in your diagnosis journey when you were in medicine, like medical school? Were
Yeah.
you in school during that point?
Yes, I was. I was having a really hard time being in medical school when my symptoms got really bad. And it's funny because oftentimes people who are in medicine can be some of the worst patients because I think I was so wrapped up in my own schooling that I felt like, oh, I really didn't prioritize my own health. And it really wasn't until I got into grad school, the grad school portion, like the PhD portion, that my symptoms just unfortunately exacerbated to the point where I was like, I'm either going to go to the hospital right now or I'm going to go find a doctor that is really going to kind of take me seriously. And I was just really fortunate to find someone who would listen. And it's really funny because at the same time, I had been learning all about Crohn's disease, irritable bowel disease, ulcerative colitis, and at sometimes even when you're in it, it's like all of these like symptoms that even though I know and would have been able to piece together for maybe a patient that I had in front of me, I didn't really do that for myself because I had been gaslit for so long by other doctors that I had seen even before I got to medical school that said, no, you can't have this because of X, Y, and Z, that I didn't even take into consideration kind of my own background, my own history. You look back at it and you're like, even if I didn't have this one particular lab value that is typically indicative of a particular process, I had XYZ, the whole gambit. And so looking back, I was just like kind of scratching my head because I'm like, man, this should have been obvious to me. But when you're in it, it sometimes it totally just like blows over your head. And so it really was it was a little bit shocking when I finally got the diagnosis and looking back being like, duh.
That is so interesting of kind of feeding into my doctors say it's not this, so I'm just going to believe them because they're the experts, and
Yeah.
believing yourself in your own body. And I think
Yeah.
that's a challenge we all deal with, especially as females, or because
Yeah.
we're told, oh no, maybe we're just exaggerating, or maybe
Yeah.
it's just all in our head.
Exactly. And I had too many doctors tell me, oh, it's anxiety. And I'm like, oh, trust me, I've got that too. This is not my typical anxiety. I'm like,
Yes.
anxiety
Yes.
should not make you bleed out of places that shouldn't be bleed. Yeah, but it really gave me, I think the most important part of this whole experience, especially feeding into me wanting to be a doctor myself, was perspective. Patients come in at the most vulnerable periods of their life, and it's difficult enough to share kind of the things that are going on. And it just really having a doctor that will listen and really do their best to understand that patients know their bodies best. They may not know what's going on, but they know when to take their own symptoms seriously for the most part.
Yes. Oh my goodness. I was just while you were saying that, I have a patient on the psychiatric floor that I'm working with who has ulcerative colitis. And we were
Mm-hmm.
actually having a similar conversation the other day because he's on the psychiatric floor, but
Sure.
he also has ulcerative colitis. And so we were talking about that difference of at what point does one impact the other, stress and anxiety. He has an opioid use disorder, but he has
Mm-hmm.
an opioid use disorder because of his chronic pain. So really
Yeah.
working, it's like you said, it's so important to have an interdisciplinary team and perspective because just like our bodies I always say the brain is just another organ. It's not
Oh,
separate
yeah.
at all.
No, it influences everything. No, there's this whole thing with the gut brain axis, and there's so much that we
Yes.
still don't know. And I feel like that is also a trap that doctors can fall in because we're put in this position of power, but we still have to realize that we don't know everything. We're learning new things every day in the field. So, you have to stay willing to understand that you don't know everything. You
Yeah.
never will.
Yeah. I'm interested. You mentioned that you decided to go the pathology path. What was that path to pathology versus internal medicine?
Yeah, I think a big part of it played off of when I was in graduate school. I'm one of these people, I loved every aspect of medicine. All of my rotations, I had a really good time. I loved seeing patients and talking to patients, but I feel like where I really excelled was when I had visual data to really think about. I did a lot of microscopy and a lot of immunohistochemistry and those types of things during graduate school. And I just fell in love with it. My strength is really at identifying patterns visually. I'm really good at visual spatial recognition and looking at something that I could see myself doing all day, every day for the rest of my life. It really was incorporating all of these pieces of data that come from a patient's story and really nailing down a diagnosis. And pathologists aren't necessarily 100% needed to do that, because obviously there's a lot of things that can be diagnosed clinically, but especially the way medicine's moving to be more personalized and diagnostic, I just really felt that was my niche because pathologists, I think, get overlooked a little bit as, since we don't necessarily speak to the patient, it doesn't mean we don't take in the whole patient to make a diagnosis. The clinical record and the notes and everything really are so vital to what we do. It's just, we may not be getting the data directly from the patient's mouth. So yeah, it was just, I don't know, it felt right for me. I think so much of finding your specialty, as I'm sure you can attest, is just, where do you feel home? And that was home for me.
Yes. Oh my goodness. I very much agree. And finding what you are best at, what exactly like you said, where can you pretty much be there, and it being home, finding your
Yeah.
people, finding what you're good at and you enjoy, that's what we want. We want medical students to find that.
Mm-hmm.
We don't want them to go into something that they're like, actually, I went in it for the money. Now the money
Oh
is
yeah.
everything. It's not what I thought it was. So.
Yeah, you got to be able to wake up every morning and feel invigorated and feel like you're doing something that is not only making a difference, but also bringing you internal sasatisfaction as well.
Very much. And I also liked how you said something that I didn't even think about, of the use of how pathologists use notes. And it kind of gave me in my own head of, oh, I need to take note of that my notes are not just written for myself or for
Yeah.
the nurses or for the patients. This can actually have a difference in a pathologist being able to
Yes.
diagnose something. And I think that is a really helpful tip that you provided, that I really hope people take that in, especially if
Yeah.
you be like a provider that is more patient facing, like you said.
Exactly. I think a really good example of this is for example, a personal anecdote. So my mom was diagnosed with breast cancer a few years ago, and she's doing wonderful. She's in remission and doing great, but she had to have therapies, obviously. And one of those therapies was radiation. And one of the things that radiation can do to breast tissue is make the normal architecture look real funky. And that can be really scary to a pathologist if they don't have that piece of information. And sometimes if that treatment wasn't really highlighted in their provider's notes, a pathologist might go down a scarier path. If somebody goes in because they're like, oh, they have maintenance, they found maybe another lump or something like that, and a biopsy was taken in an area where there were those radiation changes, it's really important for us to know, because we can be like, oh, this scary batch of cells is actually not something it's something we expect to see there. So yeah, so knowing the really important information from their provider that's seeing them on a much more regular basis is vitally important to us.
Yeah, wow. Yeah, that is super important. I never even thought about that.
Yeah.
Sometimes we gloss over the medical history, and
Yep.
you'd include that in a note. But yeah, that is huge. That can really make people go down a different path for treatment, or maybe
Yes.
scare them or scare.
Yeah, exactly.
You don't
Unneeded stress.
Unneeded stress for sure. I'm interested. You mentioned that you've been on biologic medications. How have you worked with that while being in school? Maybe being with clinics in places that can be more less
Accommodating, maybe.
yeah, yeah. I'm interested because I know some medications can be more impactful to your autoimmune system. How did you navigate that situation? And of course, accommodations.
Yeah, that's a great question. I was really fortunate to have, well, I think step one was being very honest and open with my program when I got a diagnosis and when I really needed kind of the flexibility to start treatment, to go in and get infusions and things like that. Eventually, I got onto a medication that allowed me to do injections at home, which is much, much preferable to going and getting a 2-hour infusion. But most of them at least required that to start. And having a program that was like, yeah, I requested accommodations early on. And I think as a medical student, that can be really intimidating because you don't really want anything, any type of asterisks associated with your name, right? And I think that especially doctors can be a little nervous of that and nervous of getting judged by peers, by mentors, things like that. But I just really went at it with, hey, I'm going to be completely honest. This is not something that I can help. In fact, I always really approached it as a strength because of the perspective that it gave me. And I was just really lucky to have administration and things that were really, they were like, absolutely, we're here to accommodate you how you need. And then also taking a biologic and being in a situation where that does make you a little immunocompromised definitely was a little nerve-wracking, I'd say. I was always really cognizant, I still am, about masking when I'm in patient areas and things like that. I do think that going into Path is maybe a little bit easier for that regard. We still have to be really careful about PPE, especially when we're grossing or doing autopsy or things like that. On the day-to-day, it's okay to, if I'm at my microscope or something like that, it's not so nerve-wracking, but it's definitely something to think about and makes you, again, appreciate, especially patients that are similarly on biologics or cancer patients that are really immunocompromised that rely on others taking their health into consideration. All of that kind of led to, again, a perspective of, oh, wow, I'm the patient now. Makes me think about the experience of the people that I'm treating all day long.
100%. That's what I was thinking of. Immunocompromised.
Yeah.
I'll say that
Yeah.
again, that way I can make sure I cut that in. Immunocompromised. Thank you for sharing that. I think that is something that people there was concerns of that during the pandemic because I went to school. I went to clinicals during the pandemic time. So that was a huge topic. But then
Yeah.
after that, I feel like that concept disappeared. And it's not like patient people that have immunocompromising conditions disappear. They're still physicians, they're still healthcare providers.
Yes.
It's really good to hear from your perspective and how it's just part of life. It's not this huge thing.
Yeah. It's crazy how those things that in healthcare are just very normal became so politicized and strange. And so I think talking about it and being like, I was watching The Pit a few weeks ago, which I love that show. It was so great. And one of the doctors had mentioned, oh, because there was a hubbub about wearing masks, and the doctor was like, okay, we have to perform a surgical procedure. Would you like your surgeons to wear masks and gloves or not wear masks and gloves? And it was like an affront. Oh my gosh, yeah, I want them to wear. Think
Huh.
about what you're saying. And so it's like a
Yeah.
similar process of protecting people that don't have immune systems to protect themselves. And so I think just being really open and honest, if I go traveling, you better believe I'm wearing a mask because I don't want to get sick. Similarly, if I have something that I'm bringing home from the hospital, I don't want to give it to other people. So it's just, I think everyone could do with a little more consideration to their fellow human.
Oh, 100%. And it also reminds, I'm actually right now, I'm preparing a PowerPoint for a wellness talk for the new incoming intern class tomorrow. And one of the things that that I have a slide on is how stress can impact your immune system. And
Oh,
thankfully,
yeah.
here, a lot of stress. And so that is definitely
Mhm.
the time that you're just more at risk. So I remember how many times I got colds and sicks and had more flares just
Yeah.
because I was stubborn of wearing a mask in the emergency room. But now I know if I'm going to
Yeah.
be going through the emergency room, even when I'm not stressed,
Yeah.
it's just like,
Oh, I'm masking up.
oh yeah, I
You
learned that
better
the
believe
hard
it.
way. Oh
Yeah.
yeah. Okay, so you just went through the residency app process, did you not? Tell
I
me
did.
about how that went for you, if you disclosed your health condition, and how you ended up deciding on a program that was best for you and your needs.
Absolutely. So, yes, I did. Actually, one of the questions when you apply for residency is, do you have any, it's basically an extenuating circumstances question. Have you had any hardships or disadvantages or disabilities that you want to speak on? And because my Crohn's played such a huge part just during my training up until that point, I was very open about it. because it was something that I was going to be open about in residency anyways, that I wanted a program to know that this is a part of me and it's something that I feel is strength. And what's really interesting, I didn't have many programs ask about it actually, but the one program that actually really did was the one that I chose, which was Mass Gen Brigham. And the program director, who is so kind, literally the first thing she asked me after we did introductions was, she was like, yeah, I just wanted to ask about your health, not for any reason, but I want to know how you're doing. Are you doing okay during this process? And I thought that was just like, I like to be open about things. I really appreciate when people ask me about that kind of stuff because I think it's important to have an open dialogue about it. So I really appreciated it. And that was something that was very telling to me when I was choosing a program, because clearly they made a point to ask about personal things that were very important. And it's honestly, that has continued to be true. They really prioritize wellness. They really prioritize taking care of yourself and being very open about if you're not feeling well or not doing well. They want to support you. And that was certainly a priority when I was looking for a program. Obviously, I'm still brand new, but it seems like I made the right decision.
Good. Oh, I'm so glad you had that experience. I think
Yeah.
I had a very similar experience. And after I did that, it's been so important for me to connect with other people who are in the application process because it's just so scary of,
It is.
oh, do you disclose? What do you disclose? What do you not disclose? So I've written a couple articles, one on DocSim and then one on MedPage Today that talk about that specific concept because
Yeah.
it is hard. And there is these rules that they are not allowed to ask directly because it is a protected class under age, just like marriage, just like race, like
Sure.
protected. But at the same time, it's really good that finding a program that they are still in their boundaries, but then also
Yes.
can still demonstrate to you that they care about you. And that's the
Yes.
reason that they're
Yeah,
asking.
exactly. Because I put it in my application for a reason. Now, it's, you don't put anything in your application that you don't have the intention of talking about. And a lot of times I brought it up on my own when talking about other reasons for wanting to become a physician and go into pathology and things like that. But it was nice to know, I just want to know how your health's doing. Like, how are you doing with this process? How are you doing managing this stress? They're like, I remember how stressful it was applying for residency. And so it's just, yeah, I think it's important to have an honest conversation, especially with your leadership, about any type of issues that you might foresee or like health things, because these are the people that are going to be your point people for the next 4 or 5, however many years. And they're going to get to know you in a very personal capacity, not going a year or two and then all of a sudden having a major flare up to be like, oh, by the way, I have this chronic condition. And them being like, I wish I would have known. We would have not done things a certain way or maybe had your schedule set up a little bit differently. So I'm a big proponent of anyone in training disclosing, of course, what they're comfortable with, but really being open. I don't, at least in my experience, more good than bad has come out of it.
I'm so glad you said that. I think more of those stories need to be shared because it's not, I know medicine is changing. So as we get more into this ability to think about just people being humans.
Yes. Yes. We're all in this crazy thing called life together, and everyone has their own experiences. And I think it's so easy to really get wrapped up in your own existence. And it really lends towards empathy when you have conversations with people who have a different experience towards you. And I think as physicians, that should be one of our number one characteristics, is the ability to empathize with people. Even if you haven't experienced anything similar, just knowing that, oh, this is an experience that can be really tough.
100%. Thank you. And you know what? You just mentioned something about scheduling. Now that you're like at the first couple weeks, how have you, is there things that you've done to prepare for scheduling? Are there any tips as you're in this first couple weeks on how to prepare for navigating your health condition?
Yeah. So for me, so my partner and we moved like quite a distance. We were coming from Houston and then now we're in Boston, and it's a really large change. I think one of the things that I would recommend, especially for people who are moving for residency, is to give yourself some time to establish the new consistency for you. Get into a good sleep regime. Like for me, sleep is really important to my health and to preventing flares and things like that. And we had to get a new bed. We had to adjust to going from maybe a quieter area that we lived in to a more hustle and bustle city. We had about 10 to 12 days before residency started from when we moved into our new apartment to adjust, to get new routines, to figure out like what time do I need to go to bed? What time do I need to get up in order to leave? So by the time everything actually started for me, I felt comfortable. There wasn't a lot of anxiety. I knew how to take the public transportation because we practiced. And I didn't want to leave anything that I couldn't have control of. There's enough things that we don't have control of, right? But I wanted to take and empower myself to know the things that I could know, and then take assurance in the fact that I had control over anything I could. And so I think that's the biggest tip I had, is to just set yourself up for success as much as you can, get good sleep habits, figure out where you're going to eat, especially for people that have IBD. Food is a really important thing. And so figuring out accessible grocery stores or markets. We're really fortunate to have a fresh market every weekend really close to our house, so we can get fresh fruits and vegetables, and that's really important to us. Also, figuring out where to live. I live really close proximity to one of the hospitals, so if I do have an issue, it's easy for me to get home. I don't have a long commute. These are the things that we put a lot of thought into when choosing where we were going to live, and making sure that things were set up for success as much as they could be in the event that things with my health went a little south.
I love that. Sleep, moving in early,
Yes.
empowerment, learning what's in and out of your control. That's excellent.
Yeah.
Gina, as we start to wrap up, you provided so many amazing tips on your journey, but looking back, is there any more tips of wisdom or pearls of wisdom, like to say, that you want to provide to other trainees that are going through maybe a similar experience?
I think the biggest thing I would recommend, and it's been consistent throughout our chat, is to just be open. Be open and honest, and seek out peers that maybe can relate to you. I think one of the things that's so important, it's really easy for people in med school, grad school, to silo themselves. It's easy to really get wrapped up in your own bubble, not reach out for help, or in the similar vein, networking, right? Who you know and the relationships that you build, especially during this time of your medical training, is really important, even more so than you think, because so much of medicine is opportunities based on the fact that, oh, I know this person at this program, and maybe they can point me in the direction of a really great doctor for my condition. I was fortunate to have a gastroenterologist in Houston who knew one in the Boston area. I had a connection that I could reach out to be like, hey, even if you can't be my GI here, do you have knowledge of ones who are accepting patients and things like that? I feel like so much of my ability to set up success for myself was based upon just interactions with people that I had, and the fact that I was willing to talk to and be open with anybody. So that can be a scary thing, obviously, especially since a lot of doctors and people in our field are introverted, and I am myself. But push yourself, be vulnerable, be open, and things will work out most of the time.
Yes, thank you. Yeah, I love that. You provided so many great tips to set yourself up for success. So thank you.
Of
And
course.
what I like to do, I like to give a quick summary of all the amazing things that you talked about. So you start off by just saying you always wanted to become a doctor, but really it was the problem solving technique, the problem solving ability that really got you. And that actually got you not just in the MD track, but the MD PhD path, where you are very passionate about understanding patterns and going outside just the typical algorithm. And it was very interesting that you also talked about how during the schooling time is where you ended up really going through a lot of healthcare struggles, which after years of going through different doctors that maybe did not support that did not support you in getting a proper diagnosis, that eventually you were able to do it. And interesting enough, it was a pathologist, and that being part of the catalyst that really got you to see this additional specialty and how it can really have a huge difference in individuals' lives. We talked about how the importance of pathology, how they, even though they're not physically seeing the patient, they use the holistic of patients under using charts. And so it's so important for providers to make sure that when they're providing a sample, they provide the greater background of history, of medical conditions, of definitely radiation. There's so much other parts of it. You also were very open in talking about how using biologics and learning to request and use accommodations as not just something you have to ask for, but just being a part of your strength and getting what you need to be successful. You also talked about how you individually navigated the residency app, how you were able to use it again as a strength and also open the dialogue of sharing that it's a huge part of who you are, and trying to find a program that was equally open to work with you. And it sounds like you found it. And you finished off by just creating some great tips on how to set up for success, especially moving early, knowing what's in and out of your control, setting up a new routine, practicing, all these great pearls. So I appreciate you again for sharing your story with everyone. I am sure there will be a lot of people that are very thankful for what you said today.
Of course, Stephanie. And thank you so much for having me. I think what you're doing in your podcast is phenomenal. And I think that as many doctors as possible who are also patients should be sharing their experience. So I really appreciate the opportunity.
Yeah, thank you. Now, I think we even connected on Instagram, but if someone wants to connect with you, if they are maybe a trainee, what is the best way to connect with you?
Yeah, I'm on both Instagram and TikTok. I think I do most of my medical experience and things like that on TikTok. And so my TikTok handle is at Dr. B MD PhD. So if people want to find me on there, I really talk a lot about what it's like having Crohn's, what it's like moving for residency, things like that. Yeah, I'd love to connect with people.
Perfect. I will make sure to have all the contact information linked below for everyone. And I'll also link, there are a couple different episodes or things that I mentioned, article of how to disclose in the Residency app. So I'll include some of the articles that I've written.
Amazing.
Also, about accommodations, because that is something that people always ask about, how to do accommodations for USMLE and exams. So I'll make sure to also link those below if you're interested.
Of course, absolutely.
Thank you again for joining, everyone. Make sure you subscribe, and because I always forget to say that, you can follow me on my new handle at Steph Moss MD. So it used to be MedPsych Moss, but I was like, no, I'm going to add in the MD.
Yes.
Finally.
We earned it.
Later. Yes. You can find the podcast Life as a Patient Doctor wherever you get your podcasts. Make sure you share with at least one other person that you think will connect with them so we can share these stories of strength and humanity. So thank you, everyone, and I'll see you next time.